Hello and welcome to HW News. This is the 10th day of Unlock 1, wherein the government is trying to implement the lockdown relaxations in the country to bring about normalcy in the nation back. Now, we at HW News are bringing you this special update, special video series where we summarize the entire day's coronavirus updates in brief for you. So, let us begin with global toll. Globally, coronavirus has infected 82,88,511 people and 4,46,694 people have died due to coronavirus. In India, as of now, there are a total of 3,54,065 cases of coronavirus. 1,55,227 among them are active cases, 1,86,935 have either been cured, discharged or migrated, 11,903 people have died due to coronavirus. Today is the day when India saw almost a jump of 2,000 death toll in India's total death toll. The Union Health Ministry released its figures on Wednesday. In the last 24 hours, 10,974 cases were reported, and as I said, 2,004 people have died in the last 24 hours only. Meanwhile, Mumbai has revised the number of coronavirus deaths in the city by 862. The city administration said that there was some discrepancy in the numbers which have been corrected now. However, the correction came a day after former Maharashtra Chief Minister Devendra Fadnavis alleged that the numbers of COVID-19 deaths in the city are being underreported. Let us now move on to the important news of the day. Researchers in England say that they have the first evidence that a drug can improve COVID-19 survival rate. A cheap, widely available steroid called dexamethasone reduced deaths by up to one-third in severely ill hospitalized patients. Results were announced on Tuesday and researchers say that they would publish them soon. The study is a large, strict test that randomly assigned 2,104 patients to get the drug and compared them with 4,321 patients getting only usual care. The drug was given either orally or through an IV. After 28 days, it had reduced deaths by 35% in patients who needed treatment with breathing machines and by 20% in those only needing the supplemental oxygen. It did not appear to help less ill patients. Peter Horby of the University of Oxford said in a statement that the survival benefit is clear and large in those patients who are sick enough to require oxygen treatment. So, dexamethasone should now become the standard of care in these patients. Dexamethasone is inexpensive on the shelf and it can be used immediately to save the lives worldwide. Steroid drugs reduce inflammation, which sometimes develop in COVID-19 patient as the immune system overreacts to fight the infection. This overreaction can prove fatal. So, doctors have been testing steroids and other anti-inflammatory drugs in such patients. The World Health Organization advises against using steroids earlier in the course of the illness because they can slow the time until patients clear the virus. Researchers estimated that the drug would prevent one death for every 8 patients treated while on breathing machines and 1 for every 25 patients on extra oxygen alone. This is the same study that earlier this month showed that malarial drug hydroxychloroquine was not working against the coronavirus. Let us move on to next news. Aam Aadmi Party MLA from Delhi, Atishi Marlena, as well as Akshay Marathe tested positive for the deadly coronavirus infection on Wednesday morning. Both of them are currently under home quarantine. Earlier in the day, Delhi Health Minister Satyendra Jain was tested again for the viral disease after being brought to the Rajiv Gandhi Super Speciality Hospital late night. He tested negative and will also be tested again tomorrow. Let us move on to next news. 45% of the total COVID-19 deaths in India have been reported post the lockdown restrictions were lifted since June 1st. Even more worryingly, the rate of growth of deaths has exceeded the rate of growth of cases since June 8th. The cumulative numbers of deaths has gone up 1.33 times, while the corresponding rise in the number of cases has been 1.29 during the past week. This has meant that India's mortality rate has actually risen from 2.78% on June 8th to 2.89% on June 16th. A surge in the mortality rate is a disturbing trend as a higher number of tests implies a higher number of cases, which usually sees a drop in the overall mortality rate. Let us move on to next news. Amidst the rising coronavirus cases in Mumbai, the Municipal Corporation of Greater Mumbai has come out with a change in testing communication strategy. According to the new directives, now the patient who has tested positive will not be communicated his test results directly by the laboratories. Instead, the laboratories will have to send the test reports of a positive patient to the BMC, which in turn will inform the patient about his test results. Many have taken to social media to slam the move of the BMC, citing that it will not only delay but also complicate the entire process. The circular issued on June 13th introduces changes into the COVID-19 testing clarification policy dated June 5th. The circular says no positive test report shall be shared by the laboratory with the patient directly. The laboratory shall share the report only with MCGM, and MCGM in turn will share it with the patient. The guideline is also similar for home tested patient. However, it clarifies that those who have tested negative for COVID-19 may be shared their reports directly. The negative report won't be required to be shared with the MCGM. Reacting to the circular, former Maharashtra Cabinet Minister and BJP leader Vinod Tawde spoke to HW News and said that patient has the right to know his test report results immediately. Blaming the inefficiency of the BMC, he also said that it could result in deteriorating health conditions of the COVID-19 patients. He also suggested that if BMC has to do it, then one copy should be given to the patient and one copy should be sent to the BMC. Well, that's all for COVID-19 updates today. For more news and updates, you can log on to www.hwnews.in.
हमारे घरों में भी बच्चे होते हैं जो हमसे प्यार दुलार की आस करते हैं।
हमारा भी जीवन साथी है जिसको हमारे ड्यूटी से घर आने का इंतजार होता है।
हमारे घर में भी एक बूढ़ी माँ है जिनके लिए आज भी हम ही आंखों के तारे हैं।
लेकिन हम हमारे घरों में नहीं हैं। आपकी सुरक्षा में कोई कसर न रहे, इसलिए हम अपने प्रियजनों से दूर हैं।
हम में से ही कुछ तो अब इतने दूर जा चुके हैं कि वो वापस अपने घरों को लौट भी नहीं पाएंगे।
हमें गर्व है कि हमारे कंधों पे मुंबई शहर के नागरिकों की सुरक्षा की जिम्मेदारी है। हमारे जज्बे और बलिदान को व्यर्थ न जाने दे। इस संकट के समय में आप घर पे रहे, सुरक्षित रहे।
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, well, subscribe to our YouTube channel.
हमारे घरों में भी बच्चे होते हैं जो हमसे प्यार दुलार की आस करते हैं।
हमारा भी जीवन साथी है जिसको हमारे ड्यूटी से घर आने का इंतजार होता है।
हमारे घर में भी एक बूढ़ी माँ है जिनके लिए आज भी हम ही आंखों के तारे हैं।
लेकिन हम हमारे घरों में नहीं हैं। आपकी सुरक्षा में कोई कसर न रहे, इसलिए हम अपने प्रियजनों से दूर हैं।
हम में से ही कुछ तो अब इतने दूर जा चुके हैं कि वो वापस अपने घरों को लौट भी नहीं पाएंगे।
हमें गर्व है कि हमारे कंधों पे मुंबई शहर के नागरिकों की सुरक्षा की जिम्मेदारी है। हमारे जज्बे और बलिदान को व्यर्थ न जाने दे। इस संकट के समय में आप घर पे रहे, सुरक्षित रहे।
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.